English, but that's actually different than us. We work on disorders. So whether it's disorders that happen later in life, so like if people have strokes and they have communication difficulties because of that, traumatic brain injuries, those are things that happen later in life, or in a school setting, or birth to 3, or settings like that, we'll work on like developmental disorders more. So, we can work with people with autism, people with just language disorders and delays. I don't know, I feel very disorganized right now. Is there anything that you can think of that I'm not saying? It'll make more sense as I go through. So like production of speech sounds. So like when I was little, I couldn't say my R's. I had to go to speech. So luckily I can say that. I can say the sounds now. I wouldn't be able to do what I do. And that can be fluency. If people stutter, I can work with them, help them work on that. If people have voice disorders, I can help them with that. And then speech sounds, like I said. So the other thing that we do that a lot of people don't realize that we do is swallowing. So whether it's young kids who have a hard time with that, or whether it's adults who lose that ability because of like a brain injury or something, since it involves like the same types of muscles and area that speaking uses, we also do swallowing. So language, so this could be how sentences are put together, it can be vocabulary words, and it can be like the social use of language. So that makes me think more like autism. And then people being able to express themselves or being able to understand language. So that's a whole lot of information. Do you guys have any questions about that? No? Okay. So the next thing I have so I have a bunch of videos I'm going to show you. I just want to get this stuff out of the way that's a little bit more dry. And then we'll get into more fun stuff. So I already told you the way that I became interested. I had speech when I was little, and I kind of thought, for the most part, it was just fun. I played a lot of games, practiced my R sounds, pretty easy. And then in high school, my friend's mom had a traumatic brain injury, and I was in her club at the high school, and I remember she spoke after her injury, and she was so fluent, like she was stuttering to get through everything that she was trying to talk about, and it was just like, I don't know, I just felt really bad for her. She was a teacher, and so she was really used to speaking in front of people, but it really like held her back. And so she got really close with her speech language pathologist, and I just thought it was really inspiring. Her speech language pathologist would go to the casino with her and work on like organization skills and stuff like that. It was pretty cool. And then I also thought I wanted to be a teacher when I was younger. I was always interested in that. Then I helped out in a first grade class, and I was like, me and 30 kids? Like, maybe not for me. So most of what I do is smaller settings. So sometimes I have kids in my office, or sometimes I go into classes and help out there. So, yeah, that's good.
I don't know where your presentation just came from. It just literally...
I think it's on the Google. I think if you click back on the Google.
just Google?
Or presentation? What's this? I don't know. Oh, wait. Okay, but Miss Murphy can explain how she got into it.
Yes,
And I'll figure this out.
I became interested in speech language pathology because I knew I was interested in medical careers and I was interested in helping people, but I don't really like blood. I didn't want to be a nurse. Not very athletic, so I couldn't really be a physical therapist. So I originally went to college as a pre-pharmacy major, thinking that I could be a pharmacist. But when I got to college, I took an intro class in speech language pathology, and I really liked it. So that's kind of how I became interested, and I changed my major to that, and have been studying that ever since.
No, okay. Yeah, reason. We don't really need this right now anyway, so it's not really a big deal. Okay, so actually I was going to talk about school next, a little bit about that, but Miss Murphy's in school right now, so
Sure.
yeah.
About that.
I went to UConn for my undergrad, so for my first 4 years to get my bachelor's degree, and then I went to Southern Connecticut for my master's degree, but Miss Murphy went to UConn 6 years through, so. Okay, so, I don't know, do you wanna talk about?
Yeah, sure. So as an undergraduate, you typically get a degree in communication disorders, and you would study hearing and speech pathology, and some of like the classes that you would need to be an audiologist. So they're both combined in that undergraduate major. And then if you choose to go on and become either a speech pathologist or an audiologist, you have to go to graduate school. So I applied to a bunch of different schools and decided to come to UConn. But if you decide that you want to be a speech pathologist and you didn't study that in undergrad, you can still go to graduate school, but you're in a longer program. Typically it's 3 years of graduate school as compared to Chucta and I only did 2.
Okay, so, and then in grad school, so Miss Murphy right now is taking classes, and she is working with me. I think she already worked in UConn's clinic. I worked in Southern's clinic before you go off and you work into school, and then like a hospital setting, so you get a little bit of both worlds. So, yeah. Alright, so I think that's good. I don't know if there's anything else. Miss Murphy's going to have to take a test pretty soon.
Yeah.
It's called the Praxis.
Just signed up
So
for it.
if you are a teacher, you have to take Praxis too. For us, in order to get like our national certification, we have to take the Praxis in our area of speech and language. So it's pretty stressful, but you'll do good. Okay, so my first slide, it's okay, I can do it, is an embarrassing video for me from when I was in grad school. So you have to do like a lot of strange projects. It's less like writing and tests and stuff like that. It's more like hands-on projects to get you ready to be out in the field. So this is one thing that I did. Here I'm working with my friend who is now also a speech language pathologist, but she's in Bridgeport. And we are working on some different fluency strategies, so to help kids who stutter. So we had to pretend that one of us was the patient, or like a young kid, and then the other one was a speech language pathologist. So I think Emily is pretending to be the student, because I think that would be less embarrassing for me. Oh, okay. Grandfather's house.
Emily. Hello. This is our flexible rate road. And remember to use our flexible rate to slow down at the beginning and then speed up at the end, okay? Yep, okay. Okay. Here's a list of sentences. I'm going to say it first and then you can say it after me. Okay. The store had a sale. The store had a sale. Oh, I didn't hear your flexible rate there. Let's slow it down at the beginning, okay? The store had a sale. That was a little bit better. I think we can maybe even go slower at the beginning. Listen to me. Today is her 40th birthday. Today is her 40th birthday. That was good. I liked how you were so slow at the beginning and then you sped up at the end. We'll be busy on Friday.
So whatever. So that's enough. But so you get the idea. So a lot of what we're doing in grad school is like hands-on, practicing that you're doing it, strange things like that. I took an oral exam where like my teacher was pretending to be a student with who couldn't say her S's or something, and I had to get her to say her S's. That was kind of strange because your professor is acting like a child, but those are some of the weird things that we do. You guys have any questions about that? Okay. So we were pretending that she's a stutterer. If you like change the way that you speak, you can be more fluent. So that's basically all that I was doing. Oh, wait, hold on. Okay. Okay. So this is another video. This is not me. So this is a lot of what you do if you work with younger kids is play. So when I was in my undergrad at UConn, I worked in Birth to 3, which is a state program to help kids who are showing some weaknesses early on, so before they turn 3. So this is a lot of what I did. I would just go into the homes, play with the kids, create language opportunities, so it's fun.
Okay, about that one. Round train. Round train. Good. Brown. Pork. Okay. Brown train. No cheese. Listen to Sylvie. Brown train. Brown train. Good job, friend. Put on. Okay. No. Ice cream. Ice cream. Train. Okay. Next one. Which one? A. A. Okay. A. What is A? What's that one? B. A jet. Airplane. Airplane. Today is February the 26th.
Okay, so you get the idea, but basically she's using a puzzle and she's trying to get him to say different sounds. And so I think he didn't get the puzzle piece until he said the sound. So, yeah, holding back toys is a big part of her job with the little guys. And then she models later developing sound. So a sound is the sound that you get when you get a little bit older. So she's not having him say that yet, but she's giving him good models for that sound. So, yeah. Any questions about that? So cute, wasn't he? Yeah, so this is in YouTube, so we have to go back here. We have like 5 minutes. Okay, so these are your vocal cords. Yeah, it looks gross. So I'm going to show you a stroboscopy, which is basically a camera which goes down your nose and into your nasal cavity and then can look at your vocal cords. So I actually had this done to me when I was in grad school. Again, another strange thing that you can do in grad school. I was in my medical placement, and the placement that I was in did a lot of fees tests, which is just to see how people are swallowing and if they're safe when they're eating, or if they need to go on a different diet, which we'll talk about in a little bit. Actually, I have another video of that. So this is a little bit different because we're looking at the vocal cords. We're not looking at the swallowing capabilities. So, and I've been telling everybody in the nursing home, like, what my supervisor was saying. So, oh, it's a little bit uncomfortable, but it doesn't hurt. It's not going to be such a big deal. My eyes were crying. I thought it was very uncomfortable. So hopefully you never have to get this done. It's really, it's fine. Like, it's not the worst thing in the world, but it was uncomfortable. So as we listen to this, you're going to see, think about like a guitar, and when the strings in the guitar are more tightly strung, you're going to make a higher pitch, right? Or even a piano and the insides of that. If they're shorter and if they're not as tightly strung, the sounds are going to be a lower pitch, okay? So you're going to see that with the vocal cords. It's pretty cool. So, Ms. Murphy, will you click on that? Mm-hmm. It looks gross, but it's pretty cool. Oops. Thank you.
It's unavailable.
What? Oh no. That one's really cool too.
Wait.
Thanks. Here we go.
Oh,
I don't know why that.
That's gonna mess up again.
Oh no. Okay. Well, you know what? As much as I can hear you guys are super excited to see that video, I might just find another one to send to you because really
Yeah.
it is cool.
okay, very good. So we'll just hold on to that and then see it in our next class.
Okay, so here's another one for all you people who thought you were getting out of it. So this is a swallow study, and hopefully this one works. So basically, you are going to see the liquid or whatever, I can't remember what they are drinking. And so as they actually swallow, you're not going to see anything because in all of you guys, you have an epiglottis, and when you swallow, it comes down, it covers your vocal cords so that your breathing is safe, you don't get pneumonia. Pneumonia is when liquid gets into your lungs, which can be super dangerous. So it can make you really sick. So you're not going to see the liquid actually going down, but you are going to see afterwards that they might need to swallow multiple times to make sure that they're safe. So, will you click that this one, please? Oh my gosh, you guys are getting out of all the gross ones. I'm going to send you another one of those too.
That's okay, we can do that again.
I hope this is, I'm wondering if now all the videos aren't going to work.
Undergrad, 4 years graduate.
Let's try to click
Try
on.
taking it off safety mode. like you said.
How do I do that? I don't know how to do
Does
that.
anybody know
Figure
how
it
to
out.
do?
Try to figure it out.
No, do you know? Can Anthony look at it?
Yes, that would
Yeah.
be great.
Anthony's my technical advisor here.
Really?
Yeah.
Cool.
It's always, I always have to get a student to tell me. No.
I don't know.
How are you?
Oh, so this
I'm
one's
fine,
good.
thank you. How was your weekend? Pretty good.
All right,
Pretty
hold on.
good, yeah.
Oh, I'm flipping. Okay, so.
Oh,
Good, wow, you sat there.
I know, Jesus, he's just got the magic touch. So, this is left neglect. So when people have a stroke, it can affect all different areas of the brain. And one thing that I remember from showing this presentation last year is that it's going to look like it's his right side that he's ignoring, because for some reason, the way this was recorded, it's like flipped, but really it's his left side. You can tell because I think he has a wedding ring on. So he had a stroke on the right side of his brain, which is affecting the left side of him. So his, he physically can like see the left side, but it's like it's not even there. So with left neglect patients, they can like have a plate of food in front of them and they'll only eat the right side. And so they need like, so you'll see what she does here, but they need like a highlighter or something to get them to look on the left side, or it's like it's not even there. It's the craziest thing. I've seen videos where these patients were like in their wheelchair strolling down the hallway, and then they end up like getting stuck on the side of the wall, and like you would think it would hurt their arm, but again, it's like it's not. It's like the left side isn't even there. Do you have anything to add to that, Ms. Murphy?
Yeah, so one of the tests that we use to assess someone immediately after they've had a stroke when they're in the hospital has them kind of do a bunch of different tasks, and one of them is to draw a clock with all the numbers in it. And people with left neglect will either draw only half of the clock, or they'll draw a full circle and all the numbers are only on the right side because they just like can't even attend to things that are on the left.
Okay. So you're going to see this. It's pretty cool. All right, and thank you for the space.
Glad to hear that. You want to do some work?
Yeah, yeah.
All right, well, today I have brought in some equipment from one of your favorite sports, golf.
Ooh, wow.
So I have golf tees here, and today we're going to use the golf tees to do a little activity that helps you notice things that are on your left. You've been having a little difficulty with noticing people and objects on your left side, is that right?
Yeah.
Okay, well what we're going to do is we're going to work on top of this white rectangle that I have down here. And I'm going to place the golf tees on this white rectangle, and there are going to be 10 of them all together. Your job is to find all 10 golf tees. They can be on the right side of the board or the left side of the board. Now, before we begin, I'd like you to take your hand and just trace around my rectangle so you get an idea of how big it is and where all the tees could be.
So she's making sure that he can
Okay.
attend to the whole.
Have you reached the end?
Yeah.
Okay, keep going.
There you are.
Okay.
There we go.
So that's to get him to pay attention.
All right.
Now you'll see.
Excellent. Okay. So the golf tees can be anywhere in this workspace.
Oh, okay.
All right?
All right.
So remember, as you're looking for the tees, remember to look to your right and to your left. Okay? Are you ready?
Ready.
Just going to put them on here quickly. 10. Oh.
need a hammer.
Oh, a little more strength. There we go. There we go. Okay. All right, John, you may begin. One more. You may begin.
Okay. Here's one.
Okay, excellent.
There's another one.
2,
These are on
Here's
the
another
right
one.
side, 'cause this is wedding rings.
3.
That's the left side.
We're gonna fight over that one.
That,
4,
and there.
5. Okay. Do you remember how many I said there were on the board?
10.
Oh, 10. Okay, we have found 1, 2, 3, 4, 5. Means we have 5 to go. Do you see any more of the T's?
No.
You don't. Okay. Well, remember to look to your left. Do you see any on the left side?
No. No.
Now, why don't you take your hand and trace around the outside of the board, just to help you remember where they could be again. Oh, run into one over there. Oh, there's one. Okay, there's 6. All right. Okay, keep tracing. All the way over there.
Wow.
Yeah.
Well, I don't know.
Okay, 5. Oops, sorry. 4 more to go. Do you see them?
No.
Okay. Why don't I help you out? Let me take your hand, and here we go. Let's feel over here on the left. How about that? Right there.
Yeah.
Okay. 7. 3 more.
Let's see.
Oh. Okay, we're down to 2. Oh, good job looking to your left. Oh, 9. All right. Keep tracing. There's just 1 more. Okay, all 10. Very nice work.
Alright, so isn't that the craziest thing? It's just so weird how the brain works. So this isn't what I do every day because I'm not in a medical setting, but these are the types of things that you would see in a medical setting. So do you guys have any questions about that? That hopefully...
I just don't understand how he is he blind all the time?
He's not blind,
He just
no.
doesn't.
His eyes were completely fine. He just doesn't attend. He's not paying attention to the left side, and it's not like he's just I'm not going to pay attention to this. It's just his brain can't pay attention to it. Do you have a better way to explain it?
No, I think that's perfect. It's not that his vision is totally fine. It's just that, like we say, it's attending, so to be able to do things, you need to be paying attention, and he just can't. It's not something that he has control over.
But it was just weird because he could go around the whole board and perfectly fine, but
Yeah, it's
Right.
crazy. And if you look this up online, you'll see they'll be these patients will be hungry and they'll only eat half the plate, and it's the other half just isn't there. It's just crazy. That's crazy. So, all right, Anthony. So maybe you can help me show
Go back.
and some of the other ones.
Yeah, go back.
Go back to the other ones.
it's on the whole plate.
Now press play. Now do one more.
You have to sign in, I guess. Just go in. Alright.
There you go. There you go. That's good.
Okay. Thanks, Anthony. Yay! I'm so excited. All right, so it's going down to the nasal cavity.
Ew! Like that.
And there's the epiglottis. The epiglottis is that flap.
Oh my god, I'm gonna throw up.
And this is what your esophagus looks like. I thought you guys were medical career students. Come on. So did you see though? It went white. You didn't see it.
at them.
Because that's your epiglottis. It's protecting.
Because he's such a good oral, if I can get him to do that.
This is oh god.
Really hard down there, that one.
Yeah.
That makes sense.
Yeah, right.
I've never seen one that far.
So this thing, because that is your trachea. windpipe.
And the V is like your vocal folds, or
Yes.
your vocal cords.
Can you just open
Yep.
right at the top and show the, there we go. That's so cool. You're a great Larry Chucta.
I don't know what they're doing right now. But that's just, he's just breathing. Shake.
Okay.
Alright, so they see this? There's this liquid.
What is that green stuff?
That's the liquid. They dyed it so you can see it. But this is what you do not want. So that's why he's
And
still
how about, have people
swallowing,
had
because you need that to go down. Because if it leaks into your trachea, you can get pneumonia. You guys have to get some stronger stomachs if you're going to be medical careers.
I think that's cool.
All right. That's what I was going for here. I'm trying to show you guys like all the weirdest,
Wait, but
grossest stuff.
so when he keeps swallowing, like that part closes or something?
Yep, your epiglottis is a flap that comes over and covers your vocal folds so that nothing can get down into your lungs.
Yo, I'm gonna be scared to drink stuff now.
No, you're fine. You're fine. And plus, if I bet you that if you guys kind of start to choke, you cough. Sometimes our patients they'll lose that capability to cough. Like they won't lose the capability to cough, but they won't automatically cough. For us, it's like a reflex. If you have like brain injury, if you have brain injury, then you might not have that reflex anymore that causes you to cough if liquid's going down past your vocal cords. So you're safe. You guys are all coughing, you're all good. If somebody wasn't coughing, that would be a huge red flag, and you might say to them, okay, I want you to try to cough. Or you might need to swallow a couple times. Or sometimes they have you put your chin down to protect your air pipe. So can you think of anything else that you would like to add, Ms. Murphy?
No, I think that's it.
Okay. Okay, so let's see if we can, this is the stroboscopy. Okay, so now we're going to see the vocal folds in action as somebody's singing. So you're going to see higher pitches, and they're going to get long and really skinny. You're going to see lower pitches. Huh?
How do they sing with that?
Well, because there's nothing in the way of your vocal folds. It's going through your nasal passage, so you still have air going in and out of your mouth. Yeah, the camera goes through your nose. So that's what I was talking about before. You say, oh, it's literally uncomfortable, but it doesn't hurt. And my eyes were watering, and I was like, oh, this is awful. So, okay.
Here is a look at some normal young female vocal cords
These are normal.
during a stroboscopic exam.
So see though, they're really long now. And I think they're going to get even longer. Yeah. And see the wave? That's how your vocal folds come together, exactly, in the wave, as the air pushes them open. And see, there's the epiglottis again. So, yeah, it's cool, right?
Yeah.
So, do you have anything you want to say about that?
Sure. So in this video, those are normal vocal folds. But if they were abnormal, they may have like a growth on them or something that has kind of caused them to not be able to vibrate in that way, and they would have then a voice disorder, and they would see a speech pathologist to help make that go away.
So do you guys ever hear people who have kind of like a raspy tone to them? And like, it'll happen a lot to cheerleaders actually. My cousin has nodules, and she was always a cheerleader. And so she has bumps on both of her vocal cords so they can't come together completely. So she sounds raspy because when your vocal cords come together, they're still sort of open because those two bumps don't allow them to close. So, yeah. Yeah, so be careful. Drink your water. But you talk about, a lot of cheerleaders also know that you talk about the, like using your core, right?
Yeah.
And that's a good strategy, so that's good. Your voice sounds good. All right, so let's play this one if you don't mind, Anthony. Thank you. Oh, actually, can we pause for a second? I forgot to talk. Okay, so aphasia is when it's a loss of language later in life. Well, it doesn't have to be later in life, though. It's just a loss of language that you already had. So these patients probably had a stroke, maybe a traumatic brain injury here and there. So they lost some functioning of their brain, and now they can't use the language skills that they once had. So sometimes they will have a lot of like output, but it's all like jibber jabber, like it doesn't make any sense. So they're saying a lot, but it's not really making any sense. Sometimes you'll have people who really can't say very much, but the words that come out are meaningful. So anything that you want to add, Ms. Murphy, before I play this about aphasia?
Yeah, so we typically see it after someone has had a stroke, so it's typically in older adults, but it doesn't have to be. So I am a student at UConn right now, and I'm in their speech and hearing clinic seeing patients similar, I come here to kind of practice, and I saw a little girl a few weeks ago who came in and was kind of speaking in all babbling, like it wasn't actually words, she was just so we call that jargon, and she was echolalic, which means she's just kind of repeating everything that anyone else says. So we were doing something and I was like, nice job, and she goes, nice job. And it was kind of funny, but we sort of realized that behavior wasn't typical for a child her age, a child of 4 years old. That's not what we would typically expect. So we referred her to a neurologist to kind of look at her brain and figure out what was going on, and it turns out that she had a stroke and was actually now aphasic. So that's so she's being seen to kind of get that language back on track.
That's awful. Okay, so these guys are in therapy. So their speech language pathologist is right here, and she's gonna, I think she kind of does sentence starts, so she'll get them going and she'll say something and then they'll have to finish it. Sometimes they can, sometimes they can't. This is a music therapist, so as with any field, there's a lot of professional collaboration. So in the school, I work with teachers, I work with school psychologists, I work with guidance counselors, special education teachers, OTs, PTs, all that. I have worked with a music therapist actually here, but there's, in a nursing home, again, you're going to work with nurses, PT, OT again, doctors, APRNs, so it's important to be able to communicate with other people and kind of advocate for your field no matter what you guys go into. So they're working together, it's pretty cool. So, all right, Anthony, can you press play for me?
Birthday to you. That's number 1. Here's number 2. Happy birthday to you. The look on your face.
So she's saying them and asking them, is this right or is this wrong?
On that one.
And something
Are
as
you
simple as
changing
having a
number
birthday
1?
can be hard.
Yeah, the look on your face kind of said it all. Sometimes hearing the word that maybe doesn't go there, wow, that really sticks out. I can tell. You gave a big thumbs down right away, no way, that does not work. All right, so let's try a different song, okay? How about... The answer, my friend, is blowing in the... Is that here already? The answer, my friend, is blowing in the... Nice job, guys. I think Allison and I heard you all say the missing word. That's exactly what we want you Now, find it on the board.
So now they're tapping into written language.
Blowing in the. Can I guess with that one? Okay. Curtis, what do you think? We're split again. Blowing in the sand,
Oh, yeah.
blowing in the wind. I made them probably too similar.
Yes.
Should we listen to them maybe in the song?
Okay. Number 1. The answer, my friend, is blowing in the sand.
That was number 1.
Yeah.
There's number 2. The answer, my friend, is blowing in the wind.
Yeah.
Well, you guys have a whole different reaction for that.
All right, so
I think we found it.
thanks.
Blowing
Anthony, you
in
can
the-
press the space bar again. So see what they were doing? They were filling in the words, so they're tapping into auditory, they're tapping into their expression. Are they able to say the word that they think of? Written language. So when I was in Southern's clinic and I was working with people with strokes and with aphasia, we used like the Scrabble tablets and had them try to put the letters together into the right words when they were given a picture. So yeah, there's all different things. I miss that stuff. I like that. Oh, back to the one before. Yeah. Oh no, never mind. You went too far before. Okay. So this might be familiar because there have been a lot of commercials lately about smoking and tracheoesophageal prostheses, or TEP. So when you have, when you guys speak, you have a larynx, and that's your speaking mechanism. So there's, there's cartilage and there's bone, and it allows you to speak because you shape the sounds as they come up through those vocal folds, which we saw before in the video. And then, so I'm using my lips, I'm using my tongue, I'm using my teeth, and even my throat to shape different sounds, okay? So if you lose your larynx, if you have to get it taken out, whether it's cancer or for some other reason, the air would no longer be going up through your larynx to get shaped. So, so you get the tracheoesophageal prosthesis. So I kind of talk about it a little bit there. So lung air can be directed through the mouth by closing off the stoma, which is the hole in your throat that they will put there so that you can still,
Wait, so that's like in that commercial? Where
yes.
That's what that is?
Yep. With the woman, yeah. And she takes off like all of her wig and her, yep. So closing the stoma can be done with a finger, thumb, or a hands-free valve. So I think that's what he's using here. I can't remember, I haven't looked at this in like a year. And so you're able to shape the sounds in the same way. So Anthony, will you press play for me or click on that so that we can see it?
My name's Bill Barber, and I'm from Baltimore, Washington. In January 2010, I started to get a hoarseness in my throat. I went through some tests here in Swedish. They found a rather large tumor on my left vocal cord. So that's what I was referring to Dr. Kim.
So in terms of laryngeal cancer, some of the meaningful options we have is radiation and surgery. Bill went through radiation first, and unfortunately in his case, the radiation did not work very well. And at that point, the only meaningful option left would be surgery. He required a total laryngectomy, so that means completely removing the entire voice box.
Dr. Kim and I essentially recreated the throat and rerouted the esophagus and the windpipe so that Bill would be able to ultimately swallow again and speak again.
The most unique aspect of his cancer care was in fact Bill himself. It's his personality and his motivation.
My first thought was, wow, I gotta think what's gonna happen with Lisa, my wife. Then I quickly said, it is what it is. This is the hand I've been dealt. So we're just gonna fight this. myself that I wasn't gonna let this beat me. If it was gonna kill me, it's gonna kill me. But I'm not gonna let it beat me. The most important part
Alright, so
was
that's
Dr.
enough of
Kemp.
that. So he's speaking now because that valve it allows him to breathe, so it allows air in, but then it closes off when he goes to speak, which allows the air to go up through, the same mechanism, through your, so that he can still shape the sounds with his teeth, tongue. Yeah, is there anything I'm missing there? Am I explaining that okay?
Yeah, and so the prosthesis is actually, it's just like this little piece of plastic like this, and it goes inside that stoma, the hole that they create, and a speech pathologist is the one that inserts it and changes it every 6 months. I think you need to get it changed, but you have to be like an expert in that and be like very specialized in that area.
Yeah, when I was in undergrad, I went and observed somebody at Yale New Haven Hospital, and I saw her change it, and it's, because it grows like fungus and stuff on it, so that's why you have to change it, and so that was kind of to me, but it's cool, it's great that now you can have your larynx removed and you can still speak. Years ago, you would have been stuck. Okay. Oh, I thought stuff's back there. Okay, so AAC stands for Augmentative and Alternative Communication Devices. This guy is using very advanced AAC. AAC can go all the way down to like using cards to communicate, picture exchange communication. So if one of my students who's nonverbal wants to communicate that he wants music or that he wants food, he can give me like a symbol that says I want and then give me the food. And eventually if a student gets really good at this, they can start commenting and really communicating well. So this is just an activity. This was for practicing he, she, plus verb, ing. So this probably wouldn't really be used for communicating, but you can pass it around if you want. This is to practice yes, no responses if a student or if somebody doesn't have that. This is so that's low technology AAC. This is kind of like mid-range. So this is a Go Talk. Unfortunately, I left the power on last year, and so it's not working right now for the sound. But if you click on these things, it'll say he, she, they, my turn, your turn. So we can pass this around. And then this is another version of a similar type of thing. So I just recorded it before I came in here, but
All done.
all done.
Copy.
So there's pictures for it. And then this is, I also forgot to pass this around, but this is our professional magazine. So the American Speech Language and Hearing Association is the association that we are certified by. And like there's a convention once a year, it's actually this week, where they all get together and they show the most recent research. I've never been able to go, but I think it would be really cool. I hope I can someday. So this is very high tech. So he's using eye gaze. So those glasses, or no. So there's like a camera over this really high tech device. And he can use his eyes to point to things. When I was in the nursing home, I got the chance to try to like program one of these and get a patient started with it. And it's crazy because, guys, just think about how often you use your eyes just to look around. So then when you have to use them to communicate and to like click on things by looking at them for an extended period of time, I used it for like 10 minutes and my eyes were exhausted. But you get used to it, and now you can see what he can do. He can communicate a lot. So, all right, Anthony, you ready?
All done.
All done.
Has spent his life building. As an entrepreneur, he founded and built Life Fitness, the world's largest fitness company. For more than 30 years, Augie was a leader in the fitness industry, and his work helped tens of thousands of Americans build their muscles. As a husband, together with his wife Lynn, he built a life full of love and adventure and raised 4 beautiful and successful children. Today, Augie serves as a National Vice President of the Muscular Dystrophy Association and Chief Inspiration Officer and Chairman of the MDA's ALS Division. He's also the driving force behind the MDA's Augie's Quest research initiative that has raised more than $17 million for ALS research. Augie continues his journey by building hope for others who, like himself, are living with ALS.
Does anybody know what ALS is? Or Lou Gehrig's disease?
Yeah.
Okay, so it's, do you want to give me a little explanation or do you want me to do it? Okay, so basically his brain functioning and his cognition, his thinking, and his language is still there, but he lost like all of his ability to speak, to like move, so he's pretty much, they call it like frozen in his own body. So, but it's sad because he's still able to think like you and me, and he did all these incredible things. I think it's going to tell you in a little bit, he worked for Life Fitness. If anybody ever goes to the gym here, you'll recognize that brand. But now he cannot speak. He physically can't speak, even though he has the capability to in his brain. So this is a way that he can speak using this device. It's really amazing. Anything you want to add to that?
No.
Okay. Okay. Sorry.
ALS presents many challenges, but communication is the most overwhelming. When the ability to communicate is lost, hope often goes along with it. Not only do you lose your voice, in a sense, you lose your identity. When I was diagnosed with ALS almost 4 years ago, I knew that I didn't want that to happen. And when I was starting to find it harder to move my hands, I started to explore software and hardware solutions that might help me stay connected with my friends, family, and business colleagues. Today I stay connected with my eyes. Eye tracking technology used to be confined to university research, but thanks to Dynavox, it is now real technology that solves real problems. With my eyes, I can speak, send email, control my environment, TV, DVD, etc. with infrared controls, use the internet and read books. This device has given me the power of hope. More than 90% of people diagnosed with ALS lose the will to live and elect not to go on a ventilator because they cannot communicate. It is frustrating because although my body may not function in the manner that I want it to, my mind is sharper than ever. The VMAX and IMAX give me the ability to connect with others again. As you can imagine, this is extremely powerful and has given me the ability and will to live. The inability to communicate is not only difficult for the individual living with the condition, it also presents concern for loved ones. I have been fortunate to share this journey with my wife, Lynn.
I think as the wife of someone who is having a harder time communicating, as you're not able to communicate as well, it gets very lonely. From a caregiver's perspective, from a family perspective, and because of the Dynavox and the IMAX, Augie can talk to me. We can still have conversations. We can still share. For Thanksgiving, he took it with us to
It's basically like a touch screen computer. Now people sometimes use iPads, but to get insurance funding can be a lot more difficult. So that's why you might. And, you know, if kids especially, not an adult, has a Dynavox, has an iPad, they're likely to want to use it for games and not for communication. So, sorry this took so long. I don't know, do you guys have any questions for me about anything? Yes.
What is a typical
What?
work?
A typical work week? Well, it depends on where you are. It can be very different depending on where you are. For me, I'm here the same hours as the teacher is. During the work week, I will evaluate students by doing testing. I'll work in the classroom, kind of helping teachers with the vocabulary, grammar, comprehension skills that I work on specifically. We'll do the same thing out of the class. What else? Yes?
What do you dislike about the job?
I guess I don't know, like I was writing an evaluation yesterday, and so sometimes, I think it's more fun to work with the kids than it is to write up evaluations all day, even though we have to do it, it's meaningful, and I like when it's done, because I feel like I have a better idea of what my students are capable of, so, but, I mean, paperwork is always a downer, right? Anybody else? Yes. So this is my 4th year. This is my 4th year. Your first year, you're a clinical fellow, and that's just a year where, it's like a final year where you're kind of supervised, but you're working.
Thank you so
No
much.
problem.
That was just a wonderful wealth of information.
Sorry so much, you guys.
So good. So thank you. I'd like to collect your papers, and I appreciate your time.
Oh, yeah, you're right. You're right. That was really good. Alright.
Thank you, guys.
Bye, guys. Thank you.
I so enjoyed that presentation.
Oh, good.
I think some people
I'll
are
share that with you.
Yeah. Gabrielle's face was great. In some of those she was so funny. Hey, Brooklyn. Thank you. Thank you. Got your name on it. There's not a little heart on it.
It is.
Oh, it's on there. Okay. Thank you, Victoria.
What is your full name? Because I'll share it with you so that.
So it's Jay Lamb.
Jay.
Let me turn this off that way.
Oh, there you are. Okay.
So wonderful. And
Oh, good.
I